Hi, folks. Welcome to Health Talk from Marz. It's out of this world. And today I want to talk about 3 signs or symptoms that may indicate that you are deficient in magnesium and you may need more in your diet. So stay tuned. In previous podcasts, I shared with you how important magnesium is for optimal health. So today we know that the soil is depleted in many minerals, including magnesium. So even if you're eating a healthy diet, you may not be getting optimal amounts of magnesium. I want to share with you 3 signs or symptoms that indicate that you are deficient in magnesium. I'm going to discuss how to make that up in your diet and also through supplementation. Symptom or sign number 1 is heart arrhythmia. Heart arrhythmia includes atrial fibrillation, which is where the top of the heart beats excessively rapidly, causing a great inefficiency of the heart muscle. So what causes this to happen? So one of the things that we know is that a lack of ATP, which is produced during the process of called oxidative phosphorylation, happens. Oxidative phosphorylation happens in the mitochondria. These are the power organelles that powers the muscles of the heart. So magnesium is a critical nutrient to make this happen. In fact, the heart muscle stores 20 times more magnesium than what's found in the bloodstream. And that's because it needs this magnesium for oxidative phosphorylation and powering these mitochondria. So we know as we age, people get less and less food, and as a result, they consume less magnesium. In addition, there are a number of factors, including stress, which most people have a significant amount of, causes a depletion of magnesium. As stress hormones rise, magnesium excretion becomes greater, and the requirement for magnesium becomes greater. So that's why when people get stressed out, there's more of a chance that their heart can develop an arrhythmia or they can develop a myocardial infarction, which is a heart attack. So critically important is to make sure that you are getting optimal amounts of magnesium in your diet, and maybe that requires supplementation. Okay, symptom number 2 or sign number 2 is hypertension or high blood pressure. High blood pressure affects about 72% of the US adult population. So the American Cardiology Association has made a statement that there are several levels, one of which is stage 1, which a blood pressure of 130 over 85 is considered to be stage 1 hypertension. So that's really important to understand because that's why about 72% of the population has high blood pressure. What causes hypertension or high blood pressure? Essentially, 92% of hypertension is essential, which is a term used in pathology to indicate that we don't really know what causes it. But really, we do know what causes it. There is a tightness of the muscle of all of the arterioles and the arteries of the body that happens because there's a lack of magnesium. Magnesium is critical to relax the tissue, the muscle tissue of the arterioles and the arteries. Without proper magnesium, potassium leaks out of the cells, and as a result, greatly increases, again, the tightness of the blood vessels that happens. So we need to make sure that we get optimal amounts of magnesium continuously throughout the day to make sure that the smooth muscle of the arterioles and the arteries become more relaxed. Symptom 3, muscle spasms. Muscle spasms, and that can include low back pain, can include leg cramps, it can include migraine headaches. These are all conditions that are related to muscle spasm. Muscle spasm is intimately related to magnesium being deficient inside the cell. So, what we see is as magnesium levels decline in muscle tissue, you can develop some pretty severe muscle cramping. And so, things like excessive sweating, excessive workouts require increased levels of magnesium in the tissue to prevent that from happening. So, one really severe form of muscle cramping would happen in the heart, and that would be a myocardial infarction or heart attack. So, heart attacks happen because the muscle that supplies the coronary vessels becomes spasmodic, and that can be due to a clot, or it can be due to just having low levels of magnesium in the tissue, causing a tightness of the arterial walls. And that causes a lack of blood flow, which can cause a myocardial infarction or can cause angina. Angina is a lesser form of a myocardial infarction where it's not an actual heart attack, but the muscle tissue becomes spasmodic and you're having less blood flow, less oxygen, and you're having that tightness in the chest, which comes before a heart attack. So, any type of muscle cramping, as mentioned, in the legs, or chronic low back pain, chronic neck pain, or just having migraine headaches is a sign of muscle cramping and is a sign that you need more magnesium in your diet or through supplementation. Before taking any supplementation program, I think it's very important that you consult with your physician or healthcare practitioner to make sure that it's safe for you. So now here are 3 tips for getting more magnesium into your body. One would be diet. So diet is critical to make sure that you're consuming enough magnesium. Ideally, you should be getting close to about 700 milligrams of magnesium a day. So dietarily wise, there's a number of foods that have higher levels of magnesium in them. So they would include soybean products such as tofu or tempeh or any other fermented types of soybeans, nuts and seeds. Almonds have particularly high levels of magnesium in them. Legumes, so that would be lentils, black beans, pinto beans, lima beans. All these beans contain significant amounts of magnesium. Leafy green vegetables such as kale, broccoli, and as well as chard also contain significant amounts of magnesium. So making sure that your diet is chock full of these foods is going to give you higher levels of magnesium. Drinking wise, we know that in areas of the world where they have higher levels of hard water, they have lower incidence of cardiovascular disease. So hard water would be preferably advantageous to your body than compared to soft water. Also, there are a number of different drinking waters that you can buy in the store that have significant amounts of magnesium. So check your labels on your mineral water and see how high the level of magnesium is in there. Okay, supplementation wise. So this is a really critical point that I can't stress enough. So magnesium, when you take it in higher amounts, causes a loosening of your stool and eventually diarrhea. And that can actually cause a magnesium deficiency. So what's really important is how the tablet or capsule is made. So what we know is if you can release magnesium throughout the digestive tract and you have 20 feet of small intestine, if you can do that more slowly, you'll greatly increase the level of absorption that takes place with the magnesium. So there are many different forms of magnesium, including magnesium orotate, magnesium oxide, magnesium carbonate, magnesium glycinate. All these forms, yes, they can be somewhat important, but what's more important is the delivery system of the actual magnesium. So that means if you can slowly release magnesium as what we call sustained release magnesium, that will greatly enhance the absorption of magnesium to get into your cells eventually. So knowing that the difference between sustained release and timed release is really important. Timed release is where a particular product goes into the digestive tract and passes the stomach and then releases all at once at one point in the digestive tract or small intestinal tract. So that is not the ideal way to get a long-term sustained release of magnesium. What's more important is to have what we call sustained or extended release. And that means that over a period of 3, 6, even 8 hours, this releases slowly throughout the digestive tract. That will greatly enhance absorption. So that is a critical note to take place more than the actual form of the magnesium. Okay, so what I'd like to talk about is the intravenous administration of magnesium. Some people that are greatly deficient in magnesium can really not get their magnesium through diet or through supplementation, normal supplementation, because they're just not able to retain the magnesium. And these people, intravenous magnesium may be a critical component to their healing. I wanted to present to you a case that was presented by one of my mentors, Dr. Alan Gaby, about a rabbi that he treated. He treated him for what was known as cardiomyopathy. Cardiomyopathy was where the heart muscle is just not strong enough to push blood throughout the body. In this particular case, the rabbi was seen by a physician and he had blackened toes, and it was recommended that he might need amputation of these toes. And he was given basically about 2 weeks to live. So his physician told him, just go home, make yourself comfortable. And Dr. Gaby decided to take on this case, and he administered intravenous magnesium to this patient. And over the course of several weeks, the toes of the patient became reddened and pinkened, and obviously there was blood flow getting into the tissue. Eventually, this patient ended up living another 7 years compared to another 2 weeks. So that was a rather dramatic case of intravenous magnesium supplementation. And this was obviously done every other day, a few times a week, and then it was extended, throughout his remaining lifespan. Another case study I would like to present is a patient of mine who presented with atrial fibrillation. Atrial fibrillation, as we mentioned, can be related to a magnesium deficiency, where the heart muscle is just not efficiently beating properly. In this particular case, we had a patient that got cardioverted. That means they tried to stop the atrial fibrillation by doing an electrical stimulation to the heart. And within 2 weeks, 1 to 2 weeks of each of his cardioversions, they failed. So that was, an unfortunate situation. But what we decided to do was take this patient and actually fortify his heart muscle with heart nutrients and also magnesium. So we gave him a series of intravenous magnesium drips, and we supplemented him with taurine and also with coenzyme Q10 over a period of time. And then we sent the patient in to get cardioverted. So after they got cardioverted, we were very obviously concerned with him reverting back to atrial fibrillation. So we did a series of intravenous magnesium IVs. And within this period of time, the cardioversion held. We also supplemented him with a product that I developed called Cardiomagleplex. Cardiomagleplex is a sustained release magnesium that releases over 6 to 8 hours, so to maximize absorption. So we put him on a good dose of Cardiomagleplex, and also oral coenzyme Q10 and oral taurine. And to this date, and it's been about 8 months now, he's totally out of atrial fibrillation and his heart muscle is doing really well. That's a great example of making sure that the heart muscle is actually going to take a cardioversion. So to do a cardioversion without preparing the heart is like preparing for, the Super Bowl without practicing for 3 or 4 weeks. Doesn't work. You want to make sure that the heart muscle is going to be optimally saturated with magnesium. With that said, there are several techniques that we can use to measure intracellular magnesium. Certainly you can test in the blood, but the blood only contains 1% of all the magnesium in the body. If that's deficient, you are very grossly deficient. Two other ways that we can test for magnesium inside the cell. One is a red blood cell magnesium test. Red blood cell magnesium gives us a little more specificity with how much magnesium is actually inside the cell. And the last test is called an exit test. An exit test is a simple test developed by a physician from Brooklyn, New York, where you take cells from underneath the tongue and you put them onto a slide, and then you send an X-ray beam through those cells, and the different minerals will fluoresce at different wavelengths. And you can tell specifically the wavelength of magnesium if you're getting enough magnesium inside the cell. So these would be more advantageous than just checking serum levels of magnesium. Okay, to recap magnesium being deficient in the body, we have 3 symptoms. 1, arrhythmia, which includes atrial fibrillation. 2, we have hypertension or high blood pressure. 3, we have muscle spasms, which can happen anywhere in the body, low back pain, migraine headaches, leg cramps, myocardial infarction, or angina. These are all muscle cramps. So these are the main symptoms that we need to be aware of that are related to magnesium deficiency. To increase your level of magnesium in your diet, you need a whole foods, plant-based diet that includes plenty of tofu, nuts and seeds like almonds, leafy green vegetables like kale and chard, and just generally legumes are going to be higher in magnesium. But you need to diversify your nutrient intake. 2, intravenous magnesium is another possibility, especially if you have some more severe symptoms, such as chronic atrial fibrillation or hypertension. And then lastly, sustained release magnesium in the form of cardiomagleplex, which is a product that I created specifically to back up intravenous magnesium. So the closest thing you can get to an intravenous magnesium drip is to do a sustained release magnesium. Okay, if you want to learn more about cardiomagleplex, please visit my website, marznutrition.com. If you've liked this video, please click on like or subscribe below. And I want to thank you all for watching this video. Stay tuned for further episodes. Over and out.